Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest has not been highlighted. So we're going to take you through the entire CBCT and give you an idea of what is going on. On 3D rendering, you can see that the upper right quadrant, the second molar and the third molar are missing, and the first molar shows a significant periodontal bone loss. We've got significant bone loss in the lower right first molar. We've got a edentulous missing teeth in the lower anterior. We've got a missing central and lateral incisor in the upper anterior region, and we've got the upper left as an edentulous posterior region, all the way from the first premolar to the third molar. And we've got significant bone loss in the first molar and the second molar, with a cavity in the second molar on the lower left hand side. On the panoramic view, you can clearly see that the patient is interested in dental implantology, and hence we will show you all the areas where implants can possibly be placed. Now on the top left, first premolar region, that's where we have significant bone available. We've got approximately 7 millimeters of ridge height with a good 9 millimeters of ridge height and 7 millimeters of ridge width. Moving to the second premolar region here, the ridge becomes quite significantly shorter. We've got 8 millimeters of ridge width with approximately 4 millimeters of ridge height. So a sinus lift will definitely be needed in the upper left side. The fourth molar region, we've got only a 2 millimeters, 1.8 millimeters of ridge height. So a lateral window sinus technique will be needed here for better implant placement. Now moving to the lower anterior, the upper anterior region. The upper anterior region, we've got a cortical plate defect on the buccal side. So we've got 6 millimeters of ridge width with approximately 10 millimeters of ridge height in the central incisor region. So this is the most ideal location for an implant placement with bone grafting and bone augmentation on the upper anterior segment. Now moving to the lower anterior segment. The lower anterior segment, we can show you that there is only one area where two areas where implants can be placed. So here you can see we've got D1 quality of bone, very thick cortical bone, no very minimal cancellous area. We've got 9 millimeters of ridge width with approximately 10 millimeters of ridge height, and in the second incisor region we've got approximately 5 millimeters of ridge width with approximately 10 millimeters of ridge height. So we've got some areas of cancellous bone here, but again we will quantify this bone as D1, as there is very minimal cancellous bone and very thick cortical bone all around. Moving to the lower right, first molar, you can see significant bone loss. The upper molar also shows very significant bone loss. You've got sulcation involvement. So immediate implant placement in these regions is going to be slightly challenging as well. So this is the lower left area. In the lower left, you can see we've got significant bone loss with the first molar completely floating. The second molar is also experiencing significant bone loss. So overall, we've got periodontal disease. We've got just some few areas where implant placement is possible. Other areas will need bone augmentation prior to implant placement. Thank you very much.